Hello, everyone. Thank you for attending my internship presentation today. Before I begin discussing the specifics, I'd like to share a bit about my background. So I am a registered dentist from India, and I am currently pursuing my master's in biomedical and health informatics at UNC Chapel Hill. And this presentation is a part of my internship coursework, for which I was involved in 2 different activities. So for the first part, I worked as a research intern for the Healthcare Worker Project, which is focused on evaluating and identifying the factors that affect the well-being of nurses and physicians during the pandemic. This is an ongoing study conducted by the Carolina Center for Healthy Workplace Design and Worker Wellbeing. This center is one of the 10 centers of excellence for total worker health, and it is funded by the National Institute for Occupational Safety and Health. So the concepts of systems analysis and design was used in the study. Before I begin describing the study, I'd like to explain what systems analysis is. It is an application of analytical methods to design, implement, and evaluate healthcare systems for improved efficiency and patient outcomes. It aims to enhance the interactions between people, technology, and processes to optimize resource utilization, improve patient safety, and reduce costs. All this while enhancing the quality of care. So this is a system model by National Academy of Medicine, which was used in the construction of the methodology of the study, which is coming up next. So on the methodology, these are the steps followed in the study, starting from a pre-completion survey, focus groups, contextual inquiry, validation of data, prioritization of the tasks, deployment, and post-completion survey. So I was involved in the contextual inquiry, data analysis, and affinity diagram parts of the study. Moving on to the first step, which I was involved in, was contextual inquiry. Contextual inquiry is a research technique that focuses on the user's perspective. It involves observing and interviewing them while they use a product, a service, or a system in their natural environment. The aim is to gather detailed information about their needs, goals, and challenges, and this can be used to enhance the design of the product, service, or system. So in my case, I shadowed the emergency department nurses as they went about their duty, and I interviewed them during their breaks to collect data on factors affecting burnout and distress. So I used handwritten notes and voice notes to record my findings. So next step, I transcribed the voice recordings using this tool called Otter AI, and I analyzed the data. Basically, I labeled the comments made by the nurses using certain factors and constructs which were given by the National Academy of Medicine. So more about that later in the presentation. So after this is the step called affinity diagramming. So affinity diagram is a tool that visually groups ideas and information based on their relationship. It is used to organize and understand complex information. It also helps in identifying patterns and common themes from different viewpoints and ideas. So this is an example of how an affinity diagram would look. So during my diagramming session, we grouped about 370 affinity cards, which were made by printing out the qualitative data which was collected during the contextual inquiry sessions into various normally forming groups. If you see, the constructs on the left are the ones which was used to initially label the data. And the factors on the right side were the ones which resulted from the diagramming session. So this would be the end. And obviously these were made in a room. So the next steps would be to digitalize this affinity diagram into a PowerPoint presentation. So this comes to the end of my first internship. My second internship was with North Carolina Translational and Clinical Institute, commonly called as NC-TRACS. It is a grant-funded institute found as a service to research community, guiding researchers through clinical trials and regulatory approval, all the way to implementing inpatient care. So I'm currently working as the spring intern with the informatics and data science team. And my work involves developing websites, developing a website for the informatics and data science services using WordPress. I'm also creating content with a focus on I2B2. This website would be serving as the primary source of information for their services after its deployment. So I'd like to take this time to show the progress on the site as of now. So this is how the site looks as of now. We have arranged all the resources that are available for the users at the top, starting with I2B2, CDWH, that is Carolina Data Warehouse for Health, and Clark, and MRS is something which would come up next year. So if you go inside I2B2, for example, we have organized all the different sections for the users on the side in a sidebar so that it is easy for them to navigate through it. And that is the case with CDWH and Clark as well. And for Clark, we have also used this sectioning for, for Clark, we have used these navigation for them to easily move up and down. My content creation work is primarily focused on I2B2 user guide. So user guide is basically, we've split them into two parts. The first is the data domain, which basically covers all the data which is available in I2B2 for the user. This is again split up into various domains, for example, patient demographic, encounter detail, diagnosis, and all these things. These are all documented in a tabulated form. And my second part of the work is with querying tools and features, which basically concentrates on the different types of tools and features that are available for the user to work with in I2B2. So coming back to the presentation, I'm now going to focus more on I2B2. So what is I2B2? It is a web application that links with the Carolina Data Warehouse for Health and allows UNC investigators to explore and query de-identified and aggregate data. So you might be wondering what is de-identified aggregate data and how it would look. So for that, I think we can move on to looking into I2B2 in detail now. So I2B2 is split up into various panels. For example, navigate or find terms, query tool, query status, previous queries, and workplace. And this is how, okay. So I would like to demonstrate how a basic query is done using I2B2 training interface. This is not the main UNC portal for I2B2 with the current data from CDWH and everything. This is just an identical simulation of how an I2B2 application would look like. This is made for training purpose. So for example, if I want to look into a patient who is a female with who is also an Asian, and then with a diagnosis of, for example, with a diagnosis of bone connective tissue skin or breast. And then I say run query. I can request for different types of results. I can request for number of patients. I can also, for example, request for age patient breakdown. And I click on that. And I say, okay, the query will run for me. It'll basically search the database and pulls out information for me. So you can see from 35 to 44, there are 4 patients, and from different age groups, you can have different patients, and the total number of patients is 78. After your query is run, it'll be saved here on previous queries right here. For example, if you want to save this for later use, or you want to collaborate with a co-investigator, you can pull this up into here where the query is saved. In the main I2B2, you'll have a shared folder which can be used for collaboration with others. This is the most very basic query in I2B2. You can have multiple ways of querying. You can do a lot of stuff with it. For example, if you can query for same financial encounter. For example, if you're looking for a patient who was diagnosed with hypertension and was put on some kind of medication for that on the same encounter, you can select that and pull hypertension and an antihypertensive medication there and run the query. And you will be given a result where the patient was diagnosed on the same day and given a medication. That's just an example. You have temporal queries, which are much more complex with constraining population and everything. So my job here is to basically give out a clean user guide for the user to read through and understand how I2B2 can help them build their study. So this is about I2B2 in a small description. So coming back, okay, this is the final part of the presentation where I would like to talk about the lessons I've learned. I feel both of my internships were extremely rewarding experiences, and my, for example, my first research internship enabled me to appreciate the systems analysis concepts in healthcare industry and made me understand the workflow practices in a US-based hospital. And in addition to that, I was able to understand and gain real-world experience in clinical research and practices. My internship with NC Track allowed me to understand health informatics resources offered by tracks in UNC and made me really focus on I2B2. It was also a great learning experience for me to improve my interpersonal skills and gave a chance for me to collaborate with the lead project manager and the data analyst. So I would like to take a moment and thank and express my sincere gratitude to Dr. Lucas, Anna, Georgek, Mariel, Erica, all my friends and family for their unwavering support and motivation. It wouldn't have possible without everyone's support. So thank you.